Good day, everyone. Welcome to the Genius Hour. For this hour, we're going to talk and learn about obstructive sleep apnea. I am MARIVIC Reyes from BS Nursing Level 3 and also an inspiring USRN. Everyone, it's a beautiful day to save lives. Let's get started. We have definition of obstructive sleep apnea, its risk factors, pathophysiology, clinical manifestations, and medical surgical management. First, what is obstructive sleep apnea? It is a disorder characterized by recurrent episode of upper airway obstruction and a reduction in ventilation. It is defined as a cessation of breathing during sleep usually caused by repetitive upper airway obstruction, or in simple words, it is a condition in which breathing stops involuntarily for a brief period of time during sleep. It interferes with people's ability to obtain adequate rest, thus affecting memory, learning, and even decision making. Risk factors of obstructive sleep apnea are something that increases the chance of developing this condition. This includes obesity, male gender, postmenopausal status, and advanced age. The major risk factor is obesity, a larger neck circumference, and increased amount of peripharyngeal fat, narrow and compressed upper airway. To easily visualize, watch this video. Factors that may contribute to obstructive sleep apnea include obesity because more fat may be present in the walls of the pharynx, and also loss of muscle tone in your pharynx due to aging. For the pathophysiology or study of physical and biological abnormalities occurring within the body as a result of the condition. To easily understand how it works, let's watch this video. When you sleep, it's normal for the muscle in your mouth, tongue, and pharynx to relax slightly but not enough to block your airway. If you have obstructive sleep apnea, the muscle of your mouth and pharynx may relax too much. Your tongue drops on the soft tissue in the roof of your mouth, pressing it against the back of your throat. And this completely blocks the flow of air into your lungs. The lack of oxygen in your lungs wakes you up. You may gasp for air to re-establish airflow before falling asleep again. The cycle of apnea in waking up may happen many times at night, preventing a restful sleep. Clinical manifestations of obstructive sleep apnea or the signs and symptoms. It is characterized by frequent and loud snoring with breathing cessation for 10 seconds or longer, for at least 5 episodes per hour, followed by awakening abruptly with a loud snores as the blood oxygen level drops. Patients with sleep apnea may have anywhere from 5 apneic episodes per hour to several hundred per night. Classic signs and symptoms include the three S, namely snoring, sleepiness, and significant other report of sleep apnea episodes. Other signs and symptoms include excessive daytime sleepiness or fall asleep repeatedly during the day, frequent nocturnal awakening, insomnia, loud snoring, morning headaches, intellectual deterioration, personal changes, irritability, impotence, or problems that interfere with sexual intercourse and reproduction, systemic hypertension or high blood pressure in the systemic arteries, dysrhythmias or abnormalities in the heart beats or rhythm, pulmonary hypertension or high blood pressure in the blood vessels that supplies the lungs, polycythemia or an increase in the number of red blood cells in the body, and enuresis or not being able to control your pee or wetting. For the last part, we have medical and surgical management for the obstructive sleep apnea. Many patients usually seek medical treatment because their sleeping partners express concern or because they experience excessive sleepiness at inappropriate times or settings, for example, while driving a car. A variety of treatments are used: weight loss, avoidance of alcohol, positional therapy, or using devices that prevents patients from sleeping at their backs, and oral appliances such as mandibular advanced devices. In more severe cases involving hypoxemia and severe hypercapnia, the treatment includes continuous positive airway pressure (CPAP) or bilevel positive airway pressure (BiPAP) therapy with supplemental oxygen via nasal cannula. CPAP is used to prevent airway collapse, whereas BiPAP makes breathing easier and results in a lower average airway pressure. For mild or moderate obstructive sleep apnea, an oral appliance may keep your airway open. This device works by folding your jaw forward and moving both your tongue and the roof of your mouth away from the back of your throat. The most common and effective treatment for obstructive sleep apnea is the CPAP machine. This machine pumps air through a tube into a mask that fits over your nose or both your nose and mouth. The mild air pressures of the CPAP machines help to keep your airway open, enabling you to get a deep, restful sleep. And for surgical managements, surgical procedures may also be performed to correct the obstructive sleep apnea. We have tonsillectomy. It may be effective for patients with larger tonsils when deemed clinically necessary. Uvulopalatopharyngoplasty or the resection of pharyngeal soft tissue and removal of approximately 15 mm of the free edge of the soft palate and uvula. It is more effective in eliminating snoring than apnea. Nasal septoplasty may be performed for gross anatomic nasal septal deformities. Maxillomandibular surgery may be performed to advance the maxilla and mandible forward in order to enlarge the posterior pharyngeal region. Tracheostomy relieves upper airway obstruction but has numerous adverse effects, including speech difficulties and increased risk of infections. These procedures are reserved for patients with concomitant cardiovascular disease and life-threatening dyspneas or severe disability who have not responded to conventional therapy. And that's all for this hour. I hope you've learned something and please share it to others, especially for those who are experiencing this type of condition. A simple share will possibly reach them and it may save their lives. If you have questions and concerns, please comment or message me. A Derek Shepherd once said, "It's a beautiful day to save lives. Let's keep saving lives by giving them the information they needed." Thank you.